I think, at least from my point of view, the fact that AI is still relatively new to all of us and we're still in the learning phase, we're still not aware of all the risks, and we're learning as we go. So that's like, as far as I'm concerned, a big risk, that there's many risks that we're still not aware of. And the fact that a lot of AI systems often rely on third-party data sets or external APIs for training, it really increases the likelihood of data leaks or breaches or wherever it be.
When we're looking at the data that AI has collected, we want to make sure that not only are we keeping that safe, but any new data that comes in, we want to make sure that that's vetted too, because if AI is constantly learning, and we then have to be careful about what data goes in order to add to that learning, right? So we want to make sure we secure not just what data is there already, but also what goes in, to make sure that we're not adding bias, or we're not somehow tipping the scale on some of the decision points. You're going to have to do your due diligence and look at how the technology is implemented. Nothing is inherently secure or inherently insecure. It depends on how it was implemented. Now, yes, there are some other things that you have to worry about, like you might think that AI only collects what is needed. Well, not all AI is the same. So you really have to make sure that philosophy is really followed, right?
A lot of people might think that AI is the smartest in the class, and it doesn't need any human oversight, which is totally wrong. Human monitoring and ethical considerations are crucial in the AI deployment, and I know that at least at Eleos we have a few layers which involve the human factor in order to make sure that the data produced is really accurate and relevant to the user.
We also on staff have a group of clinical psychologists and clinical analysts who really make sure that the models that we are using are primed specifically for behavioral health. There are ways to make it very relevant to the type of care that is being provided in behavioral health. And it's also important for people to realize that the companies should be investing in making sure that it is relevant and not just private and safe and secure, but also touches upon relevancy of the clinical care that's being provided as well.